What do high ferritin levels mean for sickle cell iron overload? Imagine your body as a busy city, with ferritin acting like storage warehouses for iron. When ferritin levels are high, it can mean there's a lot of iron stored somewhere in the city. In people with sickle cell disease, high ferritin often points to iron overload, especially if they have had many blood transfusions. Transfusions are a common treatment to help manage anemia and prevent complications, but each one adds about 200 to 250 milligrams of iron to the body. Since the body cannot easily get rid of excess iron, it starts to build up in vital organs like the liver, heart, and glands. This buildup can cause damage over time if it's not managed properly. But here's where things get tricky. Ferritin is not just a marker of iron stores. It's also an acute phase reactant, which means it can increase when the body is fighting inflammation, infection, or liver injury. These are common issues in sickle cell disease, so a high ferritin level doesn't always mean there is too much iron. It could be a sign of inflammation or liver stress instead. That's why doctors don't rely on a single ferritin test to diagnose iron overload. They look at trends over time and combine this with other tests. One of the most reliable ways to measure iron overload is through magnetic resonance imaging of the liver, called liver iron concentration testing. This imaging shows how much iron has accumulated in the liver tissue, giving a clearer picture of the actual iron burden. If ferritin levels are above 1,000 nanograms per milliliter in someone with sickle cell disease and a history of multiple transfusions, it raises concern about iron overload. Levels over 1,500 nanograms per milliliter are often used as a threshold to start or adjust iron chelation therapy. Iron chelation therapy is the main treatment for removing excess iron. It involves medications that bind to the iron in your body and help your kidneys or bowels excrete it. Starting chelation early and monitoring iron levels regularly can prevent serious organ damage caused by iron buildup. It's important to remember that each person's situation is unique. Factors like how many transfusions they've had, their overall health, and other medical conditions influence treatment decisions. In summary, high ferritin levels in sickle cell disease can suggest iron overload, especially if the person has had many transfusions. But because ferritin can also rise due to inflammation or liver issues, it's essential to interpret these levels carefully. Combining ferritin trends with imaging tests like liver MRI provides a more accurate assessment. This helps doctors decide when to start or adjust iron chelation therapy, which is vital for protecting organs and maintaining health. Always consult with healthcare professionals for personalized advice and treatment options tailored to individual needs.